Department, and last week was actually Public Health Week. So we didn't get to shoot a video last week, but I did want to show you this week who we are as public health, especially during this COVID-19 crisis we have in the community or across the nation and the world. So we're going to give you guys a quick tour of the building on what's going on behind the scenes. We're going to visit our EOC, the DOC, and then we're going to wrap it up in the clinic to let you know kind of some services that we are still providing. So stay tuned and come along with us. All right, we are here at the Emergency Operations Center. I know a lot of you guys have asked what's going on behind the scenes at the Health Department. So during our public health crisis, any crisis in the community, or if there's any big event like with a solar eclipse, our Emergency Operations Center, which we call our EOC, is always the front runner making plans and putting plans into place just to make sure they're prepared for anything that comes up. So for our EOC in this particular room, every day we've got emergency services that meet, fire, EMS, police, county and city officials, public health. We meet with the hospital and other physicians every day just to recap on the current numbers for COVID-19, what we've seen in the community, and we just sit down and make plans for anything that may or may not happen, just so that we've got plans in place whenever anything occurs. So every day, these are the heroes in the room. They're just behind the scenes. A lot of the times we don't see, but they're the ones that are putting the plans into place that we can execute out in the community to make sure things are running smoothly and to keep the population safe and healthy. All right, here we are in the DOC. That's Department Operations Center, and it's part of the ICS Incident Command System. So we just left the EOC, Emergency Operations Center. Now we're in the Department Operations Center. And this is where our epidemiologist is located and our epidemiology nurse. And these ladies have taken a lead role and comprised a team of a lot of health department staff. So the reason we've reduced some of our other services is simply because we needed all the manpower we could have in the DOC right now. Now these are the ladies and gentlemen who call the individuals if you're a confirmed case for COVID-19. So if you have taken the test and you're waiting on that, we get those test results, we give you a call, we give you results, and then we start asking you questions about your direct contacts. And you can imagine, I think yesterday on our Facebook page we reported 70 cases that we have so far. So these are the ladies and gentlemen that keep up with those 70 cases as well as their contacts. So you can understand why we had to pull in reinforcements from different parts of the health department, because if each confirmed case had just 2 contacts, that's 140 just contacts that we have to keep up with, and then add that 70 on top of that. So we're keeping up with a large number of people just to track the virus and to make sure that these individuals are on quarantine and self-isolation. And just to check in with patients every day, to check in on their symptoms and to make sure they're doing okay, and provide them additional guidance should they need it. So this team, there's always, I call it the situation room, there's always a lot of hustle and bustle, a lot of paperwork going on. Sometimes it seems like chaos. We have a really good organized process in place to help track all of this and to keep you guys informed on what you need to be doing as a population. Behind the scenes, you've seen people in the EOC, the DOC, but I want to talk to you about the others in this incident command system. You've got those working logistics, and those are the individuals that are making a lot of the plans through the drive-through clinics. We've also got those who are in charge of operations, which is all of our supplies that we're distributing to the community to make sure everyone has everything they need. And then of course you've got communications, and we've got a team here that's been working together to make sure the media is informed, the public is informed of everything we have going on, just to make sure you've got the most up-to-date information. So at the Christian County Health Department, like I said, a lot of our staff, our roles have changed, but we are still offering our environmental services here. We are still doing temporary food inspections, because I know a lot of food trucks, since a lot of restaurants are closed, or doing curbside service have popped up. We are still offering those inspections. We're still doing dog bite reports. You can report those to us. So we are offering minimal services here in our environmental department. So if you have any questions about that, you can just give us a call. We'll be happy to answer. So here at the Christian County Health Department, with COVID-19 going on, things do look a lot different here. However, we still are offering minimal clinical services. We're offering vaccinations for the 2-month and 4-month-old babies. We are offering WIC services, as well as some STD services as well. So we are still operating the clinic. If you have any questions about that, you can give us a call, 887-4160. We'll be happy to answer those questions for you. So that, ladies and gentlemen, sums up our video for Public Health Week. If you see a public health care worker out there, make sure you tell them thank you so much for what they do. Especially right now, there's a lot going on and a lot behind the scenes that people don't even